This technique video will demonstrate a meniscus allograft transplantation. The patient that is involved in this case is a 31-year-old male who previously underwent a large meniscectomy that resulted in meniscus insufficiency and discontinuity between the anterior and posterior horns of the meniscus. He was left with continued medial-sided knee pain, and given the healthy state of his articular cartilage, he was indicated for a medial meniscus allograft transplantation. Here's an arthroscopic video demonstrating the remainder of the meniscus in this patient, and what you can see is the significant loss of meniscus tissue from the prior meniscectomy, as well as insufficiency and discontinuity between the anterior and posterior aspects of this meniscus. In order to prepare for the meniscus transplantation, we first need to remove the remainder and the entirety of the meniscus that remains in this patient. And this is done with an arthroscopic biter as well as an arthroscopic shaver. Additionally, the posterior and anterior root insertions are defined. Now, it's very important in order to remove all of the meniscus tissue because the blood supply for this meniscus that will be transplanted will come from the capsule. So when we obtain the meniscus allograft, this is how it's shipped to us. It actually comes with the meniscus tissue attached to the native tibia in a bone block. And in order to prepare this for transplantation, there are two different options. One, you can remove all bony tissue and attach the meniscus roots via soft tissue attachments to the bone, or, as I prefer in my technique, to keep the meniscus roots attached to the tibial bone and create bony plugs that will eventually go into sockets that will be prepared and drilled during the surgery. So the first portion of this procedure is to create the socket in the posterior meniscus root attachment. So we use a tibial guide in order to drill a guide pin into the center of the posterior meniscus root. This is a flip cutter drill in which the drilling portion of this guide pin is deployed and can be reamed retrograde in order to create a socket that will be equivalent to the size of the socket that was prepared from the meniscus allograft tissue. Now, once this tunnel is drilled, we use a device in order to insert a suture that will be later used as a shuttling suture to bring in the graft into the knee. Here is the anterior root insertion. Again, a guide pin is drilled in the center of the root insertion, and this is over-reamed with a reaming drill to the appropriate diameter, again, that corresponds to the graft diameter. Now, in order to bring the graft into the knee and into this anterior socket, we also have to create an additional tunnel for this suture to be passed. And here again, you see passing of this suture. Now, once these sutures are in place in the posterior and anterior root insertions, they are utilized in order to shuttle the graft into the knee. Here you can see the posterior root insertion being shuttled into this tight medial compartment of the knee. And an arthroscopic probe is utilized in order to help guide this bone plug in its position. Now, downward traction on these sutures will allow for docking of this bone, which you can see right there. Now, here's the anterior root insertion and its corresponding socket, and again, the probe is utilized in order to assist with docking of this bony plug into its corresponding socket. Now, once these bony plugs are in place, what you can see is this allograft meniscus tissue in its appropriate position. And although it's secured at the root insertions, it is not secured in the periphery around the meniscus to the capsule where the blood supply will come from. So I prefer to use standard inside-out techniques in order to perform multiple and pass multiple sutures through the meniscus tissue as well as through the capsule in a vertical fashion. Here you can see us passing the sutures both on the superior or femoral surface of the meniscus as well as the inferior and tibial surface of the meniscus. Now, what you do not see in this video is that outside of the knee there is a popliteal retractor that's positioned in place in order to bounce these needles off, and there is another assistant catching these needles to ensure safety of this procedure. So we work our way from the back or posteriorly to the anterior aspect of the knee as we continue to secure the meniscus all the way to the front or anterior aspect near its root insertion. And finally, what I like to use for the most anterior connection to the capsule is a suture passing device that can be used in order to pass the suture through the capsule, through the meniscus, and ultimately back out the portal, where we can subsequently tie a knot and thus complete the secure fixation. Now, after tying the sutures from the bone plugs over individual buttons, as well as tying of all of these meniscus sutures over the capsule, this is your final product. And what you can see is not only secure fixation of the meniscus to its anterior and posterior roots, but circumferential fixation of the meniscus allograft tissue to the patient's capsule. And the hope and that the thought is that eventually over time, the vascularity from the patient's capsule and blood supply will eventually propagate and heal this meniscus in place. Now, in order to assist with meniscus healing, I prefer to use a microfracture awl in order to perform multiple puncture holes within the non-articular segment of the notch, which allows for egress of bone marrow elements, including stem cells and growth factors that will help out with this meniscus to heal.